Hi, I'm Joe Graydon.
And I'm Terry Graydon. This podcast of the People's Pharmacy is brought to you by Squatty Potty Toilet Stools. They create healthy toilet posture for fast, easy elimination. Learn more about toilet posture and health at squattypotty.com. That's SQUATTYPOTTY.com.
Are you taking medicine that could put you at risk for dementia? A surprising number of drugs can be bad for the brain. This is the People's Pharmacy with Terry and Joe Graydon.
Some antihistamines, antidepressants, and drugs for overactive bladder are associated with dementia. The longer people take such medications, the greater the risk. Are you taking a drug that affects the crucial brain chemical acetylcholine?
How can you weigh benefits against risks when it comes to prescription medicine? Patients and doctors often overestimate how much good a treatment will offer and underestimate the potential harm.
Coming up on the People's Pharmacy, the health news that matters to you with your calls and questions.
First, this news.
In the People's Pharmacy Health headlines, the Federal Trade Commission has barred misleading advertisements for green coffee bean extract as a weight loss product. As part of the FTC settlement, the companies that were selling the supplements will have to pay $9 million to refund customers who bought the product expecting effortless weight loss. This was a no-fault settlement, according to one spokesperson. She maintains that the company admits no wrongdoing, even though it has already stopped the deceptive ads and will pony up millions in refunds.
Previous studies have linked testosterone replacement therapy to an increased risk for cardiovascular complications. Now, an in-depth analysis of testosterone research carried out between 1940 and 2014 has come to a very different conclusion. The authors report in the Mayo Clinic proceedings that men with naturally higher serum testosterone have less severe coronary artery disease. Testosterone therapies associated with less obesity, smaller waist circumference, improved exercise capacity, stronger bones, and better blood sugar control. The investigators conclude that there's no basis for warning that testosterone supplementation increases cardiovascular danger. They believe it may in fact lower risk factors and improve mortality statistics. Until a large placebo-controlled trial is carried out over many years, it will be impossible to determine whether testosterone therapy is a boon or a boondoggle.
A team of investigators at Johns Hopkins has put 9 former NFL football players through a battery of high-tech tests, including PET scans and MRIs. The men, between 57 and 74 years old, also underwent tests of verbal learning and memory. 9 age-matched controls were put through the same tests. The scientists were especially focused on a marker called translocator protein, a signal of brain damage. The overall findings indicate molecular and structural changes in the brains of the pro football players. These indicate lasting brain damage, possibly or probably as a consequence of hitting their heads so frequently. The researchers plan to look at the brains of active and recently retired players to see if the changes occur right away or if they're a delayed response to injury. A better understanding of the consequences of concussion might lead to changes in the way contact sports are played.
Smartphones have become valuable diagnostic tools, especially for cardiologists. A case study published in JAMA Internal Medicine describes a 62-year-old man who began to feel faint during daily exercise. In his doctor's office, an electrocardiogram was normal, as was an echocardiogram. His doctor suggested he purchase a device called a LiveCore cardiac monitor to use with his smartphone. The patient used the device during one of the exercise-induced episodes, and the recording made by a LiveCore permitted his heart rhythm abnormality to be diagnosed. The arrhythmia was traced to the right ventricular outflow tract and was successfully treated with ablation. Subsequently, he had no further irregular heart rhythm problems. The authors conclude that a LiveCore is a readily available, inexpensive cardiac monitoring device that may improve diagnosis of irregular heart rhythms.
The purple pill, also known as Nexium, has just gotten nose-to-nose competition. The FDA recently approved the first generic formulation of esomeprazole. The manufacturer will be Ivax, a subsidiary of the generic pharmaceutical giant Teva. Nexium has been one of the most popular proton pump inhibitors, or PPIs, used to treat chronic heartburn or gastroesophageal reflux disease. It's also used to heal ulcers and help eradicate the germ Helicobacter pylori. Once there's a generic available, many insurance companies will require its use rather than pay for the brand name drug. Nexium 24HR is now available over the counter.
Recent research has generated intense interest in the bacterial ecology of the human digestive tract. Changes in the microbiome have been linked to a range of health conditions, including autoimmune disease, allergy, and even obesity. Inflammatory bowel disease may also be associated with the bacteria of the gut. Now scientists have found evidence that viruses also play a role. A study of patients with Crohn's disease and ulcerative colitis turned up DNA from previously unknown viruses that will warrant more research. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon. I'm a pharmacologist.
And I'm Terry Graydon. I'm a medical anthropologist. We'd all like to stay sharp for as long as we can. But are you taking some medicines now that might increase your risk for dementia in later years?
An article published this week in JAMA Internal Medicine titled Cumulative Use of Strong Anticholinergics and Incident Dementia just caught our attention. We were so intrigued, especially because some of the drugs discussed are taken by millions of people every day. So we got in touch with the lead investigator. Dr. Shelley Gray is professor and vice chair of the Department of Pharmacy in the School of Pharmacy at the University of Washington. She also directs the geriatric pharmacy program there.
Welcome to the People's Pharmacy, Dr. Gray.
Thank you. I appreciate this opportunity.
Dr. Gray, what in the world motivated you to do this study in the first place?
Well, we have known for some time that these types of medications may affect memory, but the thinking has been that these are reversible effects. So when people stop taking the medication, that any changes that they note in their memory will disappear. About 5 years ago, a study came out using data from a French population that found that use of these anticholinergic medications was associated with increased dementia risk. So this surprised many of us because it was contrary to the thinking that the effects of these medications are reversible.
Tell us a little bit about what you did, and then later I'll want you to explain what is an anticholinergic drug.
Okay, so our study looked at roughly 3,400 older adults in the Seattle area, and these people have been followed for many years. So what we did is we looked at their anticholinergic medication use using pharmacy records. So we were able to look at both dose and use over a long period of time. And what we found was that those people that were using the highest amounts of anticholinergic medications, that was linked to a higher dementia risk, including Alzheimer's disease.
Now, Dr. Gray, anticholinergic medicines, I know it has a pharmacological meaning, but it's kind of a big word. Can you explain to me what sorts of drugs we're talking about?
So there is a chemical in the body that's called acetylcholine that works in various parts of the body, and that's natural functioning. And what anticholinergic medications do is they block where that acetylcholine works in the body, so it prevents acetylcholine from working.
And acetylcholine is essential for muscle contraction. It's that connection between nerves and muscles. But in the brain, it's really critical for memory. Is that right?
Yes. Acetylcholine is very important for normal cognition, such as memory and attention and learning.
Now, what were some of the medications that you found in your review and analysis?
So the most common anticholinergic medications were some of the older antidepressants, antihistamines, and some of the medications for urinary incontinence.
So we're talking about drugs that are in the class, such as chlorpheniramine and diphenhydramine. These are pretty common over-the-counter antihistamines, is that right?
Yes, both diphenhydramine and chlorpheniramine are common over-the-counter medications and often are found in over-the-counter sleep aids.
So Tylenol PM, Advil PM, and pills like maybe Sominex would contain diphenhydramine.
Exactly.
When we're talking about the antidepressants, we're talking about drugs such as doxepin and amitriptyline. Amitriptyline these days is sometimes used for nerve pain, is that right?
Yeah, so currently those medications are usually used for conditions such as migraines or nerve pain. That's correct.
And the overactive bladder drugs, the drugs that are prescribed sometimes for urinary incontinence, that would include something called oxybutynin. I forget the brand name. What is that?
Ditropan.
And it's now over the counter, if I'm not mistaken.
Yes, there is a form of that medication that is over the counter.
So here we have a class of drugs called anticholinergics that people take routinely, many of them over the counter, thinking nothing of them. There are also dozens, perhaps scores of prescription medications that also have anticholinergic activity. And I guess our biggest concern is someone might be taking a drug like cimetidine. It was once sold under the brand name Tagamet. I guess it still is, but, for heartburn symptoms, they might be taking a product to go to sleep like Tylenol PM that has diphenhydramine in it. They might be taking something for a bladder problem. They might be taking a diuretic that has anticholinergic activity. When you add up all of these little pieces, it adds up to a lot of anticholinergic activity that might affect the brain.
Yes, and that is our concern, that the use of these medications are widespread in older populations, and the fact that many can be purchased over the counter, older adults might not even be aware of the number of anticholinergic medications they may be taking.
Dr. Gray, your research was published in JAMA Internal Medicine, so doctors are going to see it, but I'm wondering what our listeners should take away from your research.
So an important message that we would like older adults to take away from our research is, first of all, not to stop any of their current medications. If they have concerns, they should bring those to their healthcare provider and have a discussion about it. But we would like older adults to be aware that many different medications may have anticholinergic effects, especially some of the over-the-counter products that many older adults think are safe because they're available without a prescription. So we would like older adults to be aware that some of the older antihistamines, especially some of the antihistamines that are in over-the-counter sleep aids, that they really should be avoiding those if possible. There are other alternatives for helping an older adult with insomnia.
I'm also assuming that you hope that health professionals will begin to recognize this potential problem, that long-term use of anticholinergic drugs may have lasting effects that could be quite devastating for older people in particular. So how do we get the word out?
So our message to healthcare providers is to regularly review their older adults' medication regimens, looking for opportunities to reduce overall anticholinergic medication use when possible. For many of these conditions, there are alternatives to anticholinergics. If a patient needs to be on a medication that has anticholinergic effects, then again, maintaining that person on the lowest effective dose and regularly, again, reviewing opportunities for discontinuing if the medication is no longer needed.
And it sounds as though older adults should also be telling their healthcare providers which over-the-counter medications they are taking.
Yes, again, an important message just overall is that older adults need to share with their healthcare providers all of their over-the-counter and herbal medication use so that the healthcare provider has a full list of medications and can make accurate assessments.
Dr. Shelley Gray, thank you so much for doing this very important research and making it available to our listeners.
Thank you for having me.
You've been listening to Dr. Shelley Gray. She's director of the Geriatric Pharmacy Program at the University of Washington, as well as professor and vice chair of pharmacy. Her study is Cumulative Use of Strong Anticholinergics and Incident Dementia. You'll find a link to it from our website.
Are many medications making us stupid or worse? We'd love to hear from you. Are you taking one or more anticholinergic drugs? How would you even know? Have you experienced the classic symptoms of dry mouth, constipation, blurred vision, difficult urination, confusion, cognitive impairment, and drowsiness? The number to call to join the conversation is 888-472-3366. Email us, radio@peoplespharmacy.com. You can get to us via Twitter @peoplespharmacy or give us a call. Again, that number, 888-472-3366.
Joe, we got a message earlier from a visitor to our website who said, you have put me into a panic. I take, 3 of these drugs, and it's just completely unfair to imply on the basis of just one study that this is a danger. And unfortunately, it's not just one study.
No, Dr. Gray referred to the 3-city study that was done in France several years ago, showing an increased risk of dementia associated with the use of anticholinergic drugs.
And there has been a recent study of benzodiazepines showing an increased risk of dementia if older people are taking these anti-anxiety agents?
Well, it turns out some of the benzodiazepines, these are anti-anxiety agents, also have anticholinergic effects. So we don't know if it's just the benzodiazepine or the anticholinergic effect or the combination. So we're talking about alprazolam. 50 million prescriptions filled last year for alprazolam. You all may remember the drug Valium. Diazepam is also a benzodiazepine.
Is it also anticholinergic?
I don't think it's anticholinergic,
okay.
But we have some concern about benzodiazepines. Besides alprazolam, there is lorazepam, Ativan. There's just a whole bunch of these, and they're taken by a lot of people every day.
And, of course, diphenhydramine, which Dr. Gray mentioned, is also known under its brand name, Benadryl.
Exactly. Now, we don't want to panic anyone, but at the same time, as she said, if you could avoid anticholinergic drugs, if there are alternatives, so much the better.
And she did say, talk to your doctor. Find out if you are taking anticholinergics.
And, everybody says it's older people, but I wonder if a younger person or a middle-aged person were taking an anticholinergic medicine for months or years, what would be the cumulative effect on their brains? Well, we need to take a short break, but when we come back, we're going to take your calls about anticholinergic drugs, but we're also going to talk about the flu. A new study suggests that Tamiflu might help keep people out of the hospital.
How well do people assess the benefits and risks of drug treatment? And we'll talk about a new FDA-approved nail fungus treatment called Jublia.
We welcome your calls, your stories at 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible by Red X Industries, makers of utterly smooth creams and lotions that moisturize deeply to make dry skin feel soft and smooth. The number's 800-345-7339. Online, uttercream.com.
And by Squatty Potty Toilet Step Stools, creating healthy toilet posture for fast, easy elimination. More information about how toilet posture affects your health at squattypotty.com.
If you'd like to order a CD of this show, you can call 800-732-2334. Today's show, number 979, or find it on the web, peoplespharmacy.com.
Today, we're talking about the health headlines that matter to you, and we invite you to join the conversation. The number, 888-472-3366. You can also email us, radio@peoplespharmacy.com, or get in touch through Twitter. We're at People's Pharmacy.
You know, Terry, when I was in graduate school, we were taught a mnemonic for anticholinergic drugs. I don't think it makes as much sense today as it did back then, but we were told hot as a hair, which means increased body temperature, dry as a bone.
Well, of course you'd be hot if you were dry, because sweating is our way of regulating body temperature, no?
True enough. And that, of course, dry as a bone means dry mouth, dry eyes, decreased sweat, as you point out. Blind as a bat was the other piece. That's because anticholinergics cause blurred vision. They dilate pupils. And in fact, if you've ever been to an optometrist or an ophthalmologist, they probably put an anticholinergic drug in your eye. Atropine was a classic for years.
Oh, that's to dilate it so they can look at it carefully.
Exactly.
And then it wears off.
Then red as a beet, a flushed face, and then finally mad as a hatter. Now, of course...
Oh, tell me more about that. Is that the dementia we're talking about?
That's the dementia or the confusion or the delirium. Of course, Mad Hatters was, I think, a mercury poisoning issue.
Well, the Mad Hatter, presumably in Alice in Wonderland, was a mercury poisoned hatter, because that was actually pretty common back in those days.
Now, I do have an email from Lori in Fort Worth, Texas. She said, I started taking ipratropium bromide nasal spray about a year ago. And when I first told the doctor that I noticed a head rush, he just stared at me and he said he'd never heard of that. The past several months, I've been experiencing brain fry every time I focus on something, and now I am sure it's the anticholinergic nasal spray that's causing this frustrating dilemma. I'm angry that the doctors aren't more aware of this anticholinergic problem.
Well, this is something that we, too, think doctors should be paying more attention to. Now, they've got a lot of things to pay attention to, but especially for their older patients, they should be looking at how many anticholinergic drugs a patient might take. It's not so easy to get a list, though.
It's not so easy. We do have a list on our website in our guide to older people. And as I said, it may not just be older people. It may affect a lot of folks.
And we also have a guide in top screw-ups doctors make and how to avoid them.
We do. We have a complete list of anticholinergic drugs. 888-472-3366 is the number to call. We go to Madison, Wisconsin. Hi, Margot. What's your question?
Yes, hello. My question is that Dr. Gray mentioned as she got off that you should tell your doctor about over-the-counter because some of those could be anticholinergic. Mm-hmm. But she also mentioned herbal. Mm-hmm. And that was provocative, and I think that, we need more follow-up on that. Are there any home remedies or herbals that we should also be concerned about? If not, I'm not sure why she would have thrown that in at the end.
Margot, I am pretty sure that there are some herbals we should be concerned about, but I have to admit that I haven't done the homework to have a list in front of me right now.
Well, it's a wonderful question, Margot, and it's one that really does need to get some attention. Damiana is one that comes to mind. Sure. Mm-hmm. Deadly nightshade, remember, is the class that we're concerned about. Belladonna is the herb that has been used for literally hundreds of years. And I think Damiana has some anticholinergic effects as well. But it's certainly worth asking at the health food store or your pharmacy to check on any herbs that you might be taking to add to. If you
ask at the health food store, they aren't going to know, I'm afraid.
You're probably right. Thank you so much for the call, Margot. It's a really important question.
Okay.
Bye-bye. Well, Tara, shall we talk about the flu while we wait for some other calls?
Let's do, because, it is still flu season. And according to the CDC, older people are being hospitalized with complications of the flu at a much higher rate than ever before. In fact, so far this year, the rate is 198 older people out of 100,000. Now, that doesn't sound like a lot, but it is.
Well, it's the most deaths from the flu in older people
That was hospitalizations rather than deaths.
Since they've been keeping records. So apparently there are a lot of consequences, pneumonia and other infections. Well, here's the good news. I'm so happy when there's good news.
Good news. Let's hear it.
Tamiflu, a new study just out this week, suggests that Tamiflu, multi-center study, I guess it was a meta-analysis, suggests that Tamiflu not only shortens the duration of flu, it's not huge, it's like a day, but more importantly, it reduces the severity of the flu.
Okay, so here's the deal on Tamiflu. You have to take it within the first 2 days that symptoms appear, right? Otherwise, it really doesn't do anything.
It's got to be within 48 hours, absolutely.
And it's better if it's sooner.
Correct.
So how do you manage that?
Well, that's the challenge, because a lot of physicians, and we mentioned this a couple of weeks ago, want to see you. Like, I'm not going to write a prescription unless I have you in the office.
And there's actually a reason for that. There's a lot of flu-like illness that isn't really flu.
Correct. But there's a rapid flu test. It takes about 15 minutes to administer. You might be able to get it at one of those urgent care centers or even at a pharmacy that has, like a minute clinic. Mm-hmm. But you need to be tested. And it, like I said, 15 minutes doesn't take long at all. But it should be over the counter. I mean, wouldn't that be ideal, Terry? I mean, just to be able to go into any pharmacy in the country or even a convenience store and test yourself for the flu.
And I would, for flu season, want to have my rapid flu test available in my own home so that if I started to feel bad, I could do a test and I'd know right away whether or not I actually had the flu. And then I could let my doctor know, yes, the test was positive, or I won't bother my doctor because it isn't actually flu.
Exactly. So Tamiflu works. It prevents hospitalizations. It prevents deaths. And I think that it should be prescribed during flu season along with a rapid flu test so people could tell whether it's going to work or not. Let's go back to the phones, 888-472-3366. We go to
Hillsboro, Wisconsin. Conrad, welcome to the People's Pharmacy. What's on your mind?
Thank you, Joe and Terry, for the program. I take the different ones that you were talking about. I take a venlafaxine, Trilipix, oxybutynin, and omeprazole. And you mentioned a couple of these, at least as far as maybe being a problem.
The oxybutynin definitely has anticholinergic effects. Now, we did talk about antidepressants, but it's the older antidepressants. I don't think venlafaxine has anticholinergic activity.
No, but there is one that's newer that most people don't even realize has anticholinergic action, and that's paroxetine, Paxil. But yours, as far as we know, doesn't, but it's the sort of thing that you should ask your physician about and your pharmacist. We would agree with Dr. Gray, do not stop any of the medications that you're on. But if you are beginning to feel fuzzy-brained, if you're concerned, definitely discuss this with your doctor and see if there might be an alternative. Good luck to you, Conrad.
Okay, acetylcholine, would that be something that would help? Did you mention that?
Well, you can't actually take acetylcholine.
Acetylcholine or acetylcholine has a couple of different pronunciations, is actually a chemical that your body makes and your brain uses. And that's why we're talking about these drugs as anticholinergic drugs, because they're blocking acetylcholine. You can't take it directly. There are some supplements that people take to try to boost their acetylcholine, and I'm not sure how effective they are. Taking it along with an anticholinergic would be crazy.
It would be like driving with your foot on the gas and the brake simultaneously. You would not make much progress. But we hope you do have a conversation with your doctor. Thanks for the call, Conrad.
Thank you.
Bye-bye.
Bye.
Let's go to Hillsboro. Hi, Jean. Welcome to the People's Pharmacy. Your question, please.
Yes, I've been taking Ambien for 20 years and want to know if the effect on dementia is reversible if I stop.
Everyone wants to know that, Jean, and we're hoping that the answer is yes, but we don't have the research for it yet. That's one of the things that Dr. Gray mentioned, is that their next focus of research will be on reversibility. And that is what the editorial focused on that was published along with Dr. Gray's research.
Now, I have to tell you, as far as we know, Ambien is not anticholinergic.
No, but it is a Z drug, and we do worry about those Z drugs having an impact on cognition as well.
You say Z drug. What does that mean?
Well, Ambien is also called Zolpidem. That's its generic name. And there are two other really popular sleeping pills that have Z in their generic name. So Zaloplan, which is, I think, Sonata. And then there's Esopiclone, which is Lunesta.
Right.
And they all can have effects on cognition, especially if you take them for a long time like Jean has. And we're hopeful that the effects would be reversible, but we don't know for sure, Jean.
We don't want to scare you, Jean, because obviously we're moving into territory where the research has not been done. So this is all kind of new to us. I mean, everybody believed, as Dr. Gray said, that anticholinergic effects on cognition were going to be reversible when you stop the medicine. The new studies suggest that may not be true. We don't know if that's also true for benzodiazepines and for the Z drugs. But we, again, encourage you to discuss this with your physician and find out if there are some other ways to overcome insomnia, perhaps CBT, cognitive behavioral therapy. Thanks so much for the call. Bye-bye. And we go to
North Augusta in South Carolina. Denise, welcome to the People's Pharmacy. Please tell us your story. Yeah.
Hi, Joe and Terry. How are you?
Hi, Denise.
I'm a psychiatric social worker, and I work in an emergency room at times. In fact, I'm on my way there now. And I see the anticholinergic reactions, what you were referring to as mad as a hatter. And sometimes I see it with as small as 2 Benadryls.
Tell us what it looks like.
Well, it looks, and I say it exactly the way that Joe did earlier. It's mad as a hatter, dry as a bone. I've seen it in as young as an 11-year-old. And it does present as psychiatric. There are usually hallucinations involved. They're very, very dry. They cannot hardly talk. They're so dry. They very often are going to see other people in the room. They're talking to other people. It's a delirium from the medication, and sometimes the emergency room doctors don't even notice it. I mean, they immediately turn them over to us because they think they're psychiatric.
And they haven't recognized that it's actually a drug reaction.
Right.
And you know what's so amazing about this, Denise? I mean, Benadryl. I mean, people think like Benadryl, it's over the counter. It's like this super safe drug.
Right.
And, you know, it's not that hard to overdose. It's also found in all of those nighttime pain relievers. In fact, Aleve PM is now advertising like crazy, but Advil PM, Tylenol PM, Excedrin PM, I mean, the list just goes on. If there's a PM in the name, it almost assuredly means diphenhydramine as part of the dose. And I don't worry about one, you know, a Tylenol PM occasionally at night. But if you're also taking one of those other anticholinergic drugs like amitriptyline, like ditropan, now all of a sudden it's a lot of anticholinergic activity. And, you know, as somebody becomes a little confused, just not as sharp as they used to be, will they attribute it to the anticholinergic drugs they're taking? Probably not, because not everybody even knows.
Well, and I'm interested, Denise, in the fact that you've seen this in a person as young as 11, and I'm wondering if that's because a sensitive individual was given an adult dose when they shouldn't have been.
Well, as I remember, she was given 2 Benadryl.
Okay.
And she was being treated as a psychiatric patient, and then I started asking the parents some questions, and we learned that she had been given a dose of Benadryl, 50 milligrams of Benadryl. And she fit every single one of the things that we would go on, you know, the mad as a hatter, dry as a bone, red as a beet. all of those things. And so that was how we determined that that's what it was.
Denise, we really want to thank you so much for bringing this to our attention and for sharing your experience with us.
Well, thank you. I really enjoy your program.
Thank you.
Thank you.
Bye-bye.
Terry, let's move on to this patient perception of benefits and risks issue.
Indeed, because this is partly what we've been talking about already. There are so many drugs that are presented as having fabulous benefit and hardly any risks. So it's no wonder that many, many patients overestimate the benefits and underestimate the risks of their medications.
Well, that's what a study in JAMA Internal Medicine published in December of 2014 has demonstrated, that in general, patients way overestimate benefits and way underestimate harms. Now, just to give you an example, because I find this kind of fascinating, there is a new prescription drug being advertised on television, and you will see it on the Super Bowl because they have a commercial that's going to show up there. But it's for a drug called Jublia, Jublia. You see a big toe with boxing gloves and a helmet.
Yeah, a purple helmet and purple boxing gloves, and this big toe is fighting toenail fungus. Okay, and it's fighting toenail fungus with Jublia. Now, it takes a long time to overcome toenail fungus because toenails grow slowly and you have to grow out a healthy new toenail, right?
Well, in the double-blind randomized controlled trials that the FDA relied on for approval, it took 48 weeks to achieve, at best, an 18% complete cure.
Right, 15 to 18%. And by the way, the harm was around 2% or a little bit more, which was ingrown toenails. Because it's a topical drug, it doesn't have huge side effects. It's not going to have psychological impact, anything like that.
Right. I'm not too worried about the side effects, but the effectiveness, 18% after nearly a year every day. And guess what?
The big harm is to your wallet.
Yeah. A 5 milliliter... It's 4 milliliters. A 4 milliliter bottle, as we tested in a local chain drugstore, $539. Now, you might say, well, $539 for a 18% cure might not be so bad, but you have to use it month in and month out. We calculated that if you had 2 big toes affected and maybe a couple of little toes, it could cost you over $8,000 for a complete cure, and I don't know if insurance would cover it.
I think I might soak my feet in a solution of vinegar and Listerine.
Yes, the question is, have you had benefits from an over-the-counter remedy, like Terry says, like maybe Vicks VapoRub? Well, we need to take a short break. When we come back, we're going to find out about a new way to treat stroke and whether booze will increase the risk of a stroke. If you'd like to join the conversation, give us a call, 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Redix Industries, makers of utterly smooth creams and lotions, helping dry, cracked skin feel utterly soft and smooth. The number's 800-345-7339, online at uttercream.com.
And by Squatty Potty Toilet Step Stools, creating healthy toilet posture for fast, easy elimination. More information about how Toilet Foster affects your health at squattypotty.com.
You can purchase a CD of this show. Just call 800-732-2334. Today's show is number 979, or visit the website peoplespharmacy.com.
Today, we're taking the mystery out of medicine. One study from the Netherlands described a new intervention for stroke that might improve a person's chance of recovery.
To learn more about this new research, we turn to Dr. Larry Goldstein. He's professor of neurology and chief of the Division of Stroke and Vascular Neurology in the Department of Neurology at Duke University Medical Center. He's also director of the Duke Stroke Center and vice chair for quality and credentials.
Welcome to the People's Pharmacy, Dr. Goldstein.
Thank you. I'm happy to be here.
It's nice to have you back. Dr. Goldstein, there was a time in medicine when if someone had a heart attack, you kind of watched and waited. You gave them a little morphine, a little oxygen, and you kept your fingers crossed hoping that things would work out. Now we have some wonderful interventions.
Now, we recognize you're not a cardiologist, and we're not going to ask you questions about heart attacks.
But we are going to ask you about the brain, because once upon a time, if someone had a stroke, we watched and we waited and we crossed our fingers and hoped things worked out. But now there are some dramatic changes. Tell us about Mr. Clean.
Mr. Clean is a randomized controlled trial that was carried out in the Netherlands that was reported very recently in the New England Journal of Medicine. You're absolutely right. Our approach to stroke has really undergone a revolution over the last 2 decades or so. The first major change was the advent of intravenous tissue plasminogen activator, TPA. That's the clot-busting drug.
Yes.
Exactly. And there are several trials that showed that treatment of patients with acute ischemic stroke, that's the kind of stroke that's caused by a blood vessel being closed off in the brain, with this medicine, if it can be done very, very quickly in a very small subset of patients, that there is a 50% improvement in the proportion of people who have no disability at the end of 3 months, a major revolution. And with that, there's been a major change in the way we approach stroke in the United States. There's been the establishment of primary stroke centers, the establishment of comprehensive stroke centers across the country, EMS protocols to get patients to stroke centers as quickly as possible, because the time saved is brain saved. The quicker we can treat, the more likely it is that patients will benefit. So that's the established therapy.
Let's talk about that time, that golden hour. What is the ideal or the optimum time before you get that clot-busting drug?
Yeah. So from the trials with tissue plasminogen activator, TPA, the quickest that can be done, the more likely it is that there's going to be a better outcome at the end of 3 months. As minutes go by, the likelihood of benefit is going down. Now, we set a 1-hour door-to-treatment time as a goal. The reason is that everybody that shows up in an emergency department that symptoms of stroke don't necessarily have stroke, so that we have to do a number of things first to try to establish the diagnosis, to make sure that it's an ischemic stroke where a blood vessel is being closed off as opposed to bleeding, and that the patient doesn't have any contraindications, that is not reasons not to administer that drug. And in the best of times, it can be done very quickly, 30, 40 minutes. But doing it within an hour is a laudable goal, not easy to do. But over the period that we have to administer the drug, which is right now up to about 4.5 hours after symptom onset, every minute that goes by, the likelihood that a patient is going to benefit is going down. So the quicker, the better.
It sounds to me as though it's going to be very important for patients to recognize when a symptom might be a symptom of a stroke, so they can go to the emergency room or the nearest stroke center if they happen to know which one that is.
Well, one of the messages that we have in terms of recognition of stroke symptoms is first that patients and families very often still ignore the symptoms. There have been a number of public education campaigns to try to improve symptom recognition. One is FAST, face, arm, speech, and the T is time. Weakness of the face, problems with speech, weakness in the arm, and then time. And the message is to call 911. There have been several studies done now that show that patients who come to the emergency room via EMS with 911 activation get evaluated and treated much quicker than patients who come to the emergency room driving in by themselves. So the first message is recognize the symptoms.
Back to Mr. Clean, which stands for, I love this title, the Multi-Center Randomized Clinical Trial of Endovascular Treatment for Acute Ischemic Stroke in the Netherlands. Mr. Clean. What did they do? Why is it a game changer?
Well, what was done was, in addition to or after, for over 80% of the patients in the trial, after being treated with intravenous TPA, the standard clot-busting drug, that patients who had an occlusion of an artery after that treatment, we believe, then underwent endovascular therapy. What that is a catheter or a tube is put into a blood vessel, an artery, usually in the groin. The catheter is then slinked up into a brain artery where the occlusion is, and the endovascular interventionalist then tries to remove that clot in any one of a number of different ways. One thing that changed with Mr. Clean as opposed to prior studies was the availability of a new mechanism, a new tool for removing those brain clots. Those are called stent retrievers. So how those work is that the catheter is put through the area of the occlusion, and a stent, which is a wire mesh, is then expanded and then removed. It grabs onto the clot and then helps pull it out. The prior devices were not as effective as these newer devices in removing those brain blood clots.
Dr. Goldstein, there's some good news, and that is that stroke deaths are coming down.
Yes, this is probably one of the major public health wins in the United States over the last few decades. In about 1937, a stroke fell from the second to the third leading cause of death in the United States. In about 2011, it went from number 3 to number 4. And then most recently, just last year, we went from number 4 to number 5 for stroke-related deaths. So heart disease is still the first leading cause of death, followed by cancer, then respiratory diseases, now accidents, and now number 5, stroke.
Stroke is devastating. It has long-lasting complications for people. It can change their life forever. Obviously, preventing a stroke is key. What are the best ways to do that?
Well, there's been some very, very good data. Not necessarily randomized controlled data because it's very, very hard to get at that. But lifestyle factors are probably among the more important things people can do to try to reduce their risk of stroke. The best examples are people who don't smoke as opposed to people who do, people who have a normal body mass index, that's a BMI of less than 25, who exercise regularly, who don't drink alcohol to excess, and follow a healthy diet. And there are a whole variety of metrics for what a healthy diet is, but it's either a Mediterranean-style diet or a DASH-style diet. People who follow those 5 healthy lifestyle factors have an 80% lower risk of having a first stroke compared to people who don't. So it's a major, major way of preventing stroke, and also probably a much stronger effect than we can get with anything that we can do with any medicine, any pill, anything that we can do to try to prevent stroke. Those lifestyle factors are of major importance.
So the take-home message, Dr. Goldstein, number 1, know the symptoms of stroke and act quickly. What are those symptoms again?
One mnemonic is FAST. That's face, arm, speech, and then time, T again. Got to call 911 quickly. People have to recognize, though, that doesn't capture all of stroke symptoms. Far from it. There's another way of thinking about it. It's called walk, talk, reach, see, feel, which is another way that people can remember it. All of a sudden, and the key here is all of a sudden, having difficulty walking, difficulty with vision in one eye or seeing in one direction, difficulty with speech, weakness or numbness on one side of the body, or a severe, abrupt onset of a headache that's atypical for somebody who has migraine and they have a typical migraine, that doesn't necessarily indicate a stroke. But somebody who doesn't have headache and all of a sudden there's a new abrupt headache that's very severe, that could be a stroke. Call 911.
Dr. Larry Goldstein, thank you so much for talking with us on the People's Pharmacy today.
I'm happy to have been here.
You've been listening to Dr. Larry Goldstein, Professor of Neurology and Chief of the Division of Stroke and Vascular Neurology in the Department of Neurology at Duke University Medical Center. He's also Director of the Duke Stroke Center and Vice Chair for Quality and Credentials.
Well, I think it's important to ask, what can you do to reduce your risk of stroke in the first place? For years, the evidence has pointed to a diet loaded with veggies and fruit as a good bet. Perhaps that's because that kind of diet lowers blood pressure, like the DASH diet.
Yes, but there might be other benefits as well. And, there's new research just out this week in the journal Stroke showing that having more than 2 drinks a day, people who did that, especially women, a woman who has more than 1 drink a day is probably getting into trouble, but people who drink more than they should were a third more likely than light drinkers to suffer a stroke.
Well, Dr. Goldstein mentioned, don't drink alcohol to excess, and people may have wondered, well, what is to excess? Now the answer from this study is that more than 2 drinks a day is excessive.
Right. And you do not want to have a stroke, I promise you. So anything you can do is really valuable. 888-472-3366 is the number to call if you want to join the conversation. We go to Burnsville, North Carolina.
Gabriel, welcome to the People's Pharmacy.
Hi, Joe and Terry. How you doing?
We're doing well, Gabriel. What's up?
Well, you were talking about the new, wonderful new medicine for toenail fungus.
Uh-huh.
And I've found, and so have several other people that I know, that just the direct topical application of a small amount of essential oil of lavender or tea tree oil, except the lavender smells better, will wipe out toenail fungus. I've seen improvement in just a couple weeks, and in a month or two it's gone for a total cost of about $5 or $10.
So it didn't cost you thousands, and it didn't take 48 weeks.
Exactly.
Well, Gabriel, we really appreciate you sharing your experience.
I'd love to hear other people's experience, especially, have you had luck with Vicks? Have you had luck with Listerine and white vinegar?
Well, Joe, it just so happens we've got an email from Rich in Alpena, Arkansas, and he says, to follow up on your comments on nail fungus, I've had a couple instances of nail fungus on my fingers. In both cases, generic Vicks VapoRub was successful in dealing with it. 100% success.
Now, I'm guessing it was not hundreds of dollars.
If it was generic Vicks VapoRub, Vicks itself only costs a few dollars for a little jar. And if you're going for the house brand, it's going to be even less.
The real point of this exercise is you have to know the benefits as well as the risks of your medicine, whether it's an over-the-counter or a prescription drug. And it's not always easy to find out how effective something really is.
Oh, and by the way, I just wanted to make a comment about the lavender and the tea tree oil, because we learned something quite interesting about lavender and tea tree oil, not in the context of nail fungus, where I think it's totally appropriate. But you were looking at some other research last week or the week before and discovered that they both have highly anti-androgenic effects.
Right. Anti-male hormone effects.
Yes, exactly right.
And so it's sort of interesting that there are so many products out there with both lavender and tea tree oil. And so young men, I'd say you might want to stay away from lavender and maybe even tea tree oil in your soap, your shampoo, and other body care products, because there was a case many years ago in which some young boys began to develop breasts after exposure to lavender body care.
Right. And we don't know of any other cases since then, but we do know that that was really what triggered people to start looking at whether lavender or tea tree oil had any impact on hormones. And what we discovered is that, in fact, they do.
Michelle in Columbia, South Carolina, welcome to the People's Pharmacy. We just have a couple minutes left. What's your story?
Thanks. Hi, Joe and Terry. This is Michelle, and I have started seeing a doctor who does Chinese medicine about 4 months ago. And I went because my asthma was so out of control. I was on so many meds for asthma that I thought there had to be a better way. So he basically changed my diet, took me off of everything but meat and vegetables. I eat very little fruit, no sugar. And as a side effect, my toenails are clearing up. My big toenails on both toes, which I have had probably 15 years, toenail fungus, are now a third clear just within 4 months.
Michelle, thank you so much for telling us about that. So getting rid of the sugar in your diet not only helped your asthma, but also helped you get rid of your nail fungus. That's pretty impressive.
Yeah, sugar and flour, just about anything I can eat.
Anything that your body's going to make
quinoa,
into sugar.
Yeah, exactly.
Michelle, thank you so much for the call.
Thank you.
Bye-bye.
Bye-bye.
Well, it turns out, Joe, that in the Mayo Clinic proceedings for this month, there is an article, actually it's in press, an article in press labeled Added Fructose, a Principal Driver of Type 2 Diabetes Mellitus and Its Consequences. And it turns out that if you really look, you will see that the fructose in our diet, which is in soft drinks and lots of things, ketchup, all kinds of things you might not expect, actually does increase the risk of people developing type 2 diabetes. And here's the next step. We're talking about the brain today. Type 2 diabetes also increases the risk of developing dementia, especially Alzheimer's disease. So if we all want to protect our brains as much as possible, we're going to really cut the sugar.
Cut the sugar and definitely
Just like Michelle did.
Eat the vegetables. Yes, 7 helpings if at all possible, and exercise more. Well, that's all the time we have. Thank you so much for listening to The People's Pharmacy. If you would like to learn more about anticholinergic drugs and whether one of those might be on your list of medications, you will find a guide to drugs in older people at peoplespharmacy.com.
Lynn Siegel produced today's show. Sophie Copeland provided technical assistance. Al Wadarski is the engineer, and Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Redix Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. That number 800-345-7339, online at uttercream.com.
If you'd like to order today's show, you can call 800-732-2334. The show number is 979. That number again, 800-732-2334. Or place the order on our website, peoplespharmacy.com. When you go to the site, you can tell us what you think about the show or find information about prescription drugs, herbs, and home remedies.
You can also subscribe to the free podcast of our show or our free email newsletter. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Please join us again next week when we talk with Dr. Bessel van der Kolk about healing from trauma. What does yoga have to offer? His book is The Body Keeps the Score.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.